Hi, my name is Jenny Dutenheffer. I am a 4th semester nursing student, and today is September 10th at approximately 9 a.m. this morning, and today I will be demonstrating trach suction and tracheostomy care. So the first thing I will do is I will assess my patient by assessing the respiratory status of the patient, and I would also assess the patient's pulse rate and assess the secretions from the trach, such as the characteristics and the amount, and then I would also assess the incision of the tracheostomy. Next, I will gather all of my supplies and make sure none of them look like they've been tampered with or been opened, since we do need sterile supplies for this. The next thing I will do is I will go into my patient's room. I will introduce myself. I will identify the patient with 2 patient identifiers. I will explain to the patient what we'll be doing and how he can help by showing me any type of distress or pain by giving me a thumbs up or a blinking of the eyes. So then the next thing I will do is I'm going to lay a towel over the patient's chest. This way it kind of keeps the patient nice and clean if anything were to get kind of messy. We will then set the patient up in an upright position. Okay. Next thing I'll do is I'll get my suction ready. So we're going to have continuous suction on, and it's going to be anywhere between 80 and 120. And I'll have this straight next to the patient so it's easy to connect to the suction tubing. Okay. I will provide privacy to my patient, and we'll go ahead and perform hand hygiene. And also we are going to hyperoxygenate the patient while we're getting our suction kit ready. So next I will open up my kit sterilely and put on my sterile gloves. Okay, after I have my sterile gloves on, I'll go ahead and grab the suction and this little box inside that I will open up. And we're going to pour normal saline into this box, knowing that I touched that, this hand is no longer sterile. So we're going to take this non-sterile hand, grab the suction tubing, and hook it up to the sterile section. After that, we'll take this off and grab this. First thing we're going to do is we're going to test our suction and moisten the tip. So just to make sure it's working, it sounds like it's working great. Next thing we'll do is we'll take the oxygen off the patient, noting it's with the hand that is already not sterile. And then we'll let the patient know that you might need to cough and might be a little uncomfortable, but we will then go ahead and do this through. And then as we're coming out, we're going to intermittently suction as we're twisting the tube out. After each pass, I would check the patient respiratory status. I will check his O2, and just to make sure he wouldn't need more passes. And if he did, I would wait a good 15 to 30 seconds between each pass. Since he is doing well and does not need another pass, I'm going to go ahead and take off this old dressing because we're going to apply a new dressing on this one. And then we're going to unhook all of this and wrap it up and throw it away. Next, what I will do is I will perform hand hygiene and get rid of the suction kit. We'll go ahead and put the oxygen back on the patient while we're getting the suction kit ready. Next, we'll open the tracheostomy care tray sterilely, and again again, we will have sterile gloves in there, and we'll put on a new set of sterile gloves. All right, so now we're going to take the drape that's already in the kit, and we're just going to kind of drape this over the patient, kind of providing another area for sterility. We'll then take our 2 packets of peroxide in the container and pour it in one compartment. And then we will take the saline and pour half of it into the peroxide and half of it into the other side of the compartment. Next, I'm going to take my non-sterile hand, and it's going to become unsterile. Like, my non-dominant hand is going to become unsterile, and we're going to take off the oxygen. And we will then remove the inner cannula. Once the inner cannula is removed, I'm going to dip it in the peroxide. I'm going to take my sterile hand, grab the sterile brush, dip it in the peroxide as well to get it moist, and we're going to clean the inside of the inner cannula until all of the secretions and everything is off of it. Once that is done, we'll dip it into the saline to rinse it off, and then to dry it, we'll take these small little white pipettes and we'll make sure that the inner cannula is completely dry before we insert it back into the tracheostomy. Okay, now that it's completely dry, we're going to go ahead and replace it. Making sure it's locked and secured inside. Once that is finished, I'm going to take my sterile hand, dip it into the saline, and using this applicator, we're going to clean underneath around the incision, making sure that it's all clean and that no gunky stuff is caught underneath there. Once that is finished, we're going to go ahead and put a new sterile dressing on. So to do this, we're just going to kind of go underneath the trach collar, putting it around the tracheostomy. All right. Once that is finished, I'm going to go ahead and take my sterile gloves off and do hand hygiene. I'm just going to put some clean gloves on, and we're going to go ahead and replace the trach collar. We're going to do this by doing a one strip method, so we're only going to take one side off at a time. So to do this, I'm going to place the new one behind the patient and release one side and attach the new side. By still supporting the trach as much as I can. And whenever you're strapping the trach collar, you want to make sure you have at least 2 fingers width between the collar and the patient. So you don't want it too tight, but you also don't want it too loose. Okay, here's the old trach collar, and this trach collar seems to be perfect within the width. I'm going to go ahead and replace the oxygen, and then we of course would turn the oxygen down to whatever liters he was starting with, and then I will document any relative data, and I think that's it. Thank you.